Hello everyone, Dr. Isha this side, your fertility coach and nutritionist from Be Healthy with Dr. Isha. Today I am joined by Dr. Shizra, who is gynecologist and obstetrician in Prime Medical Center, Dubai. So with her, we are going to bust some myths which I am hearing on daily basis from many couples around the globe who are trying to get pregnant. So thank you Dr. Shizra for joining us. Before we start, I want you to give a brief introduction about you.
I am Dr. Shizra Shahnawaz, an obstetrician and gynecologist. I did my MBBS, then FCPS, then MRCOG from UK, and then MRCPI from Ireland. And now I'm working here in the Prime Hospital from 2021 till now. So today we will talk about something about infertility.
Yeah. So thank you, Dr. Shizra, for joining us. So I'll start by the myths. So the first myth that we hear on daily basis is that infertility is a woman's problem. I think that is the most damaging belief around the globe which people carry within themselves, and they often blame the woman for being infertile and not being able to get pregnant. So can you help us with the facts about the same?
Sure. So, as she said, that we are thinking that infertility is the woman's problem, but in reality, it's not. Woman and the male, both are the partners are involved in infertility. And we can say the 40 to 50% sometimes the cause is only from the male. So it is not only the female's problem, it is also the male problem on the same, like 40 to 50% male is also involved in that one.
Thank you. Thank you for clearing that. Now I'll move to the second myth. So they say that, if a woman's periods are regular on, every month she's getting her periods on time, does that mean that her fertility is normal? Because I know many women, they always tell me that, my periods are regular. So they are reassured that, her fertility must be normal. Then why is she not getting pregnant?
So this is also the myth. If your periods are regular, it doesn't mean that you are like you don't have the problem with the infertility. Periods regular means that you have, like you have the ability, but it doesn't 100% that your egg quality is 100%, your egg quality is good, the quantity is good, the sperm quality is good, the sperm motility is good. Having only the periods regular doesn't mean that 100% guarantee of the fertility.
That's true. That's true. So there are many factors I think
Yeah,
which we
there are
need
so
to
many.
consider,
Yeah.
right? Now coming to the third myth, they also say that stress can cause infertility, right? Wherein we often say to the woman, don't take too much stress, right? So do you think that stress is a major factor which can block a woman's chances of getting pregnant?
See, stress is also playing a role in somewhere to put the signals. When the signals are coming from the brain to the ovaries, the stress can imbalance that signal, but only stress is the certain factor which make you infertile. It's not only just to say relax and you will become pregnant. It's not like that.
That's true. So there are many, factors. I think the
Yeah.
better assessment is done, of those factors, then only you will be able to manage the condition in a better way. So now the next myth that I have heard, which is like infertility means you will never get pregnant. So this term itself is very scary. So how do you define it in medical terms?
So infertility means you are sometimes taking a longer time period to become pregnant. It doesn't always means that you cannot become pregnant. See, infertility and sterility, these are two separate terminology. Infertility means you are trying to conceive, you are trying to become pregnant, and it is taking longer time duration to conceive, or you might need to take some treatment to become pregnant. But the sterility means that you cannot become pregnant. That is the another terminology. That is another problem or situation, not the infertility.
So how do you define this sterility? I mean, which woman is considered as sterile or which male is considered as sterile?
The male who is not having the sperms, they are not producing the sperms, or the women who don't have the ovaries, for those we can call that they are sterile. But infertility means that you are unable to conceive, but you can.
Right. So coming to the next myth, that is
Hmm.
use of birth control pills.
Hmm.
It can also cause infertility. I have heard many times, with PCOS, doctors are
Hmm.
giving the treatment,
Hmm.
oral contraceptives.
Hmm.
But then women fear that if they use
Hmm.
this oral contraceptive for a longer time,
Hmm.
they might not be able to get pregnant.
So, this is also the myth that oral contraceptives or the birth control treatment is not gonna make you infertile. Once you stop them, then after that you can become pregnant if you want. It is not something that will make you infertile.
Right. Now coming to the next myth, which, I think many people hold within themselves and
Hmm.
they have the dream of, making this true,
Hmm.
that IVF guarantees a pregnancy.
Unfortunately, this is also a myth. IVF is a not 100% guarantee to become a someone to make pregnant. It's not 100%. Definitely, there are certain factors, some lifestyle modifications through which we can get the success rate as maximum as possible, but it is not 100% guarantee that you will go for the IVF treatment and you will become pregnant.
Right. So with IVF also the success rate varies. So can you
Yes.
help us, understand what could be a success rate for a woman, according to her age, right?
Yeah.
So someone who is going for IVF after 35 or maybe before 35. So is there any success criteria for the same?
Yeah, definitely. See, the egg quality is very good when the woman age is less than 35. The egg quality is declined after the 35 years of age and more after the 40 years of age. So definitely when the we are making the good eggs, the success rate will increase. And when the quality of egg and quantity of egg will become decrease, then the success rate will become decreased definitely.
Right. So now, because we're talking about age
Hmm.
only, coming to myth number seven, that age only impacts a woman equality. Is that true?
See, there is a certain factors, not only the age, the hormones, the certain pre-existing conditions, other medical conditions the woman or male is having, or if the male is having any surgery or there is any other problems, there is certain lifestyle also, and also the smoking, alcohol, everything is in a combination making the woman or the couple infertile. It's not only a single thing which will make you delay to become pregnant. Not only this one thing, it is actually so many factors which is affecting in a combination, then they will make you longer time to become pregnant.
Right. And we don't much talk about, male
Hmm.
sperm
Hmm.
quality. Like
Hmm.
as males age,
Hmm.
do we also see a decline in the quality of the sperm?
Yeah, actually this is correct. If the we are always talk about the woman's age, we always talk about the woman's egg and this, but what is true that male age is also a factor. After the 40 years there is a certain in the sperm or in the semen analysis, it's also the sperm quality quantity will also become a decrease with the increased age of the male also.
Right. Now coming to the next myth, which is like most of the couples think they
Hmm.
have one child already. So
Yeah.
that will not impact their
Hmm.
fertility.
Hmm.
So is this actually a myth or is it really a fact?
Actually, this is also a myth. It doesn't mean that you have one child, then after that, it is 100% guarantee that you will bring the another child. It's not like that. After having the one child, if you gain too much weight, or if you starts the certain lifestyle like you start smoking, taking alcohol, or if you starts having other hormonal disbalance or any other medical condition, you need to seek the medical advice for the another baby. It's not like that you have first baby then you can become pregnant for the second baby also.
Right. And coming to the last one, which I feel is most of the women
Hmm.
think that, infertility is rare because everyone
Hmm.
around
Hmm.
them is
Hmm.
getting
Hmm. Hmm.
pregnant.
Hmm.
So they feel that, I am the one who's
Hmm.
left
Hmm.
out. So according to data,
Hmm.
what do you think? Is it rare or is it very common than we think?
So, yes, it is actually common. Like in every six couples, if we will take the six couples, so one is trying to conceive, one couple is trying, struggling for the infertility issue. So, it is common actually.
Thank you so much, Dr. Shizra, for clearing the myths. I'm sure whatever insights you have given us today will help these couples replace their fear with actual facts. So before we conclude the session, I want you
Hmm.
to say, any words of hope for the couples who are trying to conceive from your end.
So I just want to say that we should not discourage any couple who is trying to conceive or who is trying to become pregnant just because they are taking the longer time. But you should seek the early medical advice for the early diagnosis and the better outcome. Because if we will pick something, the root cause, as soon as possible, as early as possible, then the time to become pregnant it will be the shorter.
Right. So thank you so much everyone for watching this video. Stay tuned. If you want to contact Dr. Shizra in Dubai, I will post her contact details in the description below. Be healthy.
Thank you.